the last thing I want to talk about is weight loss. First of all, to discuss what can we expect. So there are just 9 trials. As of 2007, this is a really neat review done for the Center for Medicare and Medicaid Services. There are just 9 trials out there of eating and physical activity programs with more than 2 years worth of follow-up. And that 2 years of follow-up is really important. Why? Well, you know the old saying, it's really easy to lose 10 pounds. I've done it 20 times. And so, you know, it's one thing to take weight off, it's another thing to keep it off. So how much weight did people lose in these carefully done studies? So if you compare the people who did get the program to the people who didn't get the program, the average weight loss is 7 pounds. So, you know, that's not going to get you back into the high school bikini. And it's not going to get you back into the high school tuxedo. It is real weight loss, though. It is 7 pounds. But I think we need to be honest with people that, you know, if you watch The Biggest Loser, some people do lose 120 pounds. Some people win the lottery, but that ain't many people. So let's look at this next slide, though, which gives us, I think, some good news. A well-known study that I know some of you have seen before did a trial of changing eating and changing physical activity. They worked with 522 overweight people who had prediabetes. So these are people that glucose intolerance is the fancy term for this. Their pancreases are not, they're getting tired, they're not quite working right, but they don't have frank diabetes yet. And what they did was do a 2-year exercise and physical exercise and eating program for them, and then they followed them for another 2 years. And they found that the average net weight loss was 6 pounds. So pretty much like what the others found in the literature, 7 pounds. So kind of makes sense that we're hearing the same thing here. And what happened to their new cases of diabetes? They went down 58%. So the message here, I think, is, you know, you don't get the tuxedo, you don't get the bikini, but you do get to keep your legs, actually. And you do get to keep your kidneys, and you get to keep your heart. Because it really makes a difference, even if you lose a little bit of weight. And I think, again, this is important for us to understand. It's important for us to get this message up to those people above us, that this stuff can really make a difference. But let's not tell people they're going to lose 100 pounds on average. Now, I do want to just throw out a little bit of caution here. And you guys are just going to call me Mr. Sunshine after this. But a very neat study was published just last month in the American Journal of Preventive Medicine that looked at 7 trials, well-done trials of physical activity programs in communities. And these are things that worked. They all, scientifically, one group to another, these things all worked. The cheapest program in there was $1,300 per person per year. $1,300 per person per year. And it increased physical activity by 2 minutes a day. So how much do you think that diabetes study that I just told you about, how much it was in there? How much do you think it cost? Anybody want to guess? So it was $9,000 over those 2 years per person. So that's about $1,500 per pound of weight lost. And why do I tell you this? I mean, because you could say, let's just go home and forget all this stuff if you look at this slide. And I don't think that's the message here. Because I think that, you know, I think we can do things more efficiently, especially if we get the rest of society kind of rowing with us, you know, and the media are helping us instead of hurting us. I think we can do better than $1,300 per person per year. We're talking about changing the norms, and some of this is intangible. But I also think it really gives us another message about how serious we have to be about this. Again, we are not going to just kind of have a nice meeting, you know, and say, you know, get a little exercise. We did a program at Group Health where we got 30% of people to get up off the couch and exercise at recommended levels. They were not doing it at all, and went to recommended levels just in the course of 10 weeks. 30% of people, couch potatoes. What happened when they came back 6 months later? All gone. All gone. It's published. You can look it up. Preventing chronic disease. I mean, you've got to keep this stuff going, and you have to spend real effort here. It's not going to be done in a day. So, just to end, as I've said, I think the focus should clearly be on chronic diseases and on the behaviors that we know work. Things like stress, I'm less sure about, although I know that physical activity decreases stress, and so that's one way we can decrease stress. I think we need to take multiple tacks. We need to surround people by making it easy and making it popular and showing them how. I think we need to think about what we do and not just follow the fads. And I think at the tactical level, there's nothing better than learning from other people about, oh, we did this, and it provokes you to think. But at the big picture, what are the pillars level? We really need to be asking ourselves carefully why we're doing what we're doing and making sure, rather than, I think expecting magic bullets like HRAs to change everything. HRAs cost a lot of money. We have to realize that a lot of this is about social change, folks. And we need to be focusing on getting that social activation going. It's going to take a lasting commitment of resources. It took us 25 years to become the heaviest nation on Earth. And we are not going to change it in 25 days. We're not going to change it in 25 weeks. And we're not going to change it probably even in 25 months. I mean, this is something we're going to have to keep going on. And I think we need to have realistic expectations. I think we need to realize that weight loss programs people only lose 7 pounds, but we also have to realize that we can cut diabetes by almost 2/3 if we make that change. Same thing for tobacco. Tobacco programs are not magic. In our wildest dreams, we're going to get maybe 10% of people to participate in them a year, and that's our wildest dreams. 5% is more like what we could be expecting. But over time, that sort of change makes a real difference. We've seen it statewide with our tobacco program in Washington State. So, that's it. Hope I provoked you a little bit. Happy to answer questions.